Hello everybody. So we have an important discussion here to talk about how to go for the final kill. You have completed your MBBS, results are out. Practically by the time you complete your final year, you know what to do. Means, what's your branch? If you don't know your branch, let's not listen to this. But if you know your branch, then only this video will work. So the nutshell is, if you know your branch, then only you can prepare. And then you must know what's your target, and you should have a plan. So we have Dr. Swasti Pathak, rank 6 NEET 2016. On our left, we have Dr. Dipin, rank 15 Main 2017. And Dr. Anivita, who's doing infectious medicine DM from AIMS. Anivita, the first question goes to you. When I made a video in 2012, Swapnil, one of my students, gave me this scenario. Divide your studies and internship into 4 layers. Layer number 1, you go with final years. When you go with final years, you just have completed MBBS, you are fresh. You can just do the MCQs and go on. Do second prof, do the short subjects. In the short subjects, forensic was a part. So in short subjects, skin, anesthesia, radiopsychiatry, ENT, ophtha, ortho and forensic. And then go for the first prof, in which go for biochem because that's a subject you can complete. Then physio, you know the important topics. Most important being nerve muscle physiology. And then anatomy at the end because anatomy is huge. Akhil and Ashir had also explained in their explanation of AIMS and PGI, you need to have at least 3 revisions. Anivita, did you follow the same thing? How much time did you actually have during your internship in LH? And how did you go about it?
So we have very limited time in internship. So a 4-layer approach, as you said, is a very nice approach. But deciding on what topic to do first will be dependent on what posting you have and how much time you have in hand. For example, in the first few months, if you have a very light posting, then doing bulky subjects and heavy subjects is a good idea. But if you have a very short very heavy posting when you have only short few hours in hand, then going through short subjects, high yield subjects is a good idea. You should structure your full year of internship into 3 to 4 levels. First set should be revision of the first reading, in which you can go through only a few selected MCQ topics. The second reading should be based on primarily filtering whatever you've read through MCQs. You cannot read through all the topics again and again. You have to filter it on the basis of the most important questions. The second reading should be a very short reading of approximately a month, in which you're doing only your weak topics and primarily targeting the short subjects. And just a few days before your exam, you must go through high yield pictures that you have collected, some tables that you have collected, few pictures, very high yield scoring topics such as forensic, biochemistry and anatomy. So I think it should be a very customized approach which subject you want to read, but a layered approach is a must. You have to subdivide your time and you have to simplify every time that you read so that your revision gets easier and easier and shorter.
Dipin, what do you say about it?
Actually, I also followed a similar approach. The subjects which I studied depends on what posting I was having. So it was like when I was having medicine posting and all, so I used to do PAT questions, mainly study the PAT topics, and for final year topics, what I did was only do MCQs, because like I've just completed my final year exam, so I'm in touch with each and every subject, so only MCQ is sufficient. So just be in touch with that subject, that's sufficient for that. But for first year, second year, you have to read some theory portion, brush it up. You would have forgotten a lot of topics, so you have to brush it up. So during surgery posting, I used to read anatomy topics. During medicine, I used to read PAT topics. So something which is related, those topics I used to read. And similarly, in between, minor postings do come where you have lot of time. So whichever subject you feel it's your worst, you can spend a lot of time on that and make it one of your best subject. And during the revision time, all you have to do is like you have finished, you have brushed your first year and second year topics. Final year is you are still in touch with them. So in your second revision, just do questions of all subjects. So in the third revision, I would say like allot some approximately 2 weeks. That will be your third revision. The most important topics of each subject you have to read and see the images which you have saved or selected. And I would also suggest like during this 1 year almost course, you should be doing grand test in between, whichever is being you are using. You should do the grand test every monthly at least once, so that you know like whichever is your weak subject and which you have to stress in the next month.
Swasti, what was your approach?
I had covered the MCQs of final professional subjects in final year only, so they were pretty fresh. So I started with first prof subjects like anatomy and biochemistry, but selection of subjects depends on what postings you have. If you are having a hectic or very hectic posting, then you can take up any light sub or a short subject.
Maybe something that is your strength already.
Yeah. So you if you are having light posting, then you can go for major subjects like medicine, surgery, and I had a plan that my first reading will finish by August. So for first September I started my second revision from 1st September, and the second revision lasted for 45 days, and then the third revision which I did was it lasted for 15 days before exam.
So basically 3 revisions, and first long revision for first time reading, then a short revision to accumulate things for the final reading.
During your first reading you should read very extensively, because you will not be getting sufficient time in second reading onwards. So I didn't read the entire, like for say anatomy, I won't say that I completed entire 100% of anatomy, like 80% I covered, and then I left the remaining portion for the next
You
reading.
made sure that by August you have to touch all the
All the
subjects to the
subjects,
extent
like
you can.
80% of all the subjects.
So what were the subjects that you took up for the time when you had a comparatively free posting? The ones that you think are the most important, those ones you must have left them for the minor posting or light posting. So what were those subjects that you say at least these have to be done in good detail?
First and second prof subjects was what I did.
Basics that you have forgotten, so you have to brush it up
Yeah.
more. Dipin?
Yeah, in first year, in physiology, Ganong, in AIMS and all, they ask a lot of questions from Ganong. So they'll ask a lot of graphs, and also you have to be thorough with all the graphs. So I used to spend a lot of time in that one. In anatomy also, I had to spend a lot of time. path also I had to spend, and micro it was more of a factual stuff, so had to invest a lot of time in these. So these were the 4 subjects which I had to spend a lot of time.
I would like to say that during this internship, there'll be phases where you will be very tired, you will be exhausted, and you will have a low point where you will feel that I don't think I can study anymore, I don't think I can do this anymore. So at that time, you have to realize that everybody is doing whatever they can, and so are you. You should never undermine the fact that you are not a good enough doctor or you will not be able to do well enough in your exams. You must keep your spirits high, you must keep your friends close, try to make a group in which you can study so that you're cheerful, try to motivate yourself, try to do some recreational activities, go out with your friends, listen to some music, go play, do some exercise, do something that keeps you happy. Every day is a new day. Try to take one day as a go. Don't look at the bigger picture, don't get scared that you have to climb such a huge mountain. See and be as productive as you can in that one day, and try to be happy so that whatever you're learning, at least you're retaining. Don't lose your heart. Everybody is struggling, everybody is going through whatever you are doing, and nobody remembers whatever they're reading. You have to keep revising, and you have to stay confident that at least what you're doing the best of your ability.
So you don't the monotony, so that whatever you're reading, even if you're reading for 4 hours, at least it's staying with you instead of sitting for 10 hours and in the end realizing that you don't even remember what you read. So what did you do for the purpose of images? A lot of images have been coming up. So in internship, so what was your way of tackling the image-based questions, Dipin?
So first you have to go to the previous year questions and see what type of questions they are asking. For example, in PATH they were asking like the characteristic images they were asking. In case of ENT and all, they were asking more of a clinical approach, like audiogram they were asking. In derma sport diagnosis, well, like characteristic images they were asking. So first understand like what type of question they are asking. Then find similar topics like tentative, like they can ask topics from this one, an image can come from so and so topic. So think in the reverse order and then find out those images and save it. For physiology and all, what I did was like I made a list. So like in page number so and so, this image I have to read. So I made a list. So in Robbins and in physiology, anatomy, I followed this rule. And for other subjects, clinical and all, what I used to do is I just Google it, download and save it in a folder.
Swasti?
I also did the same. I had separate folders in my phone because that way it becomes very handy. You can always revise things up while having tea or having, you can have a little discussion with your study partner as well, and you can just go through those images if they are very handy. So
do you think like is internship always a problem? Is there a way you can benefit from doing internship as well? What can you do while you're on the internship that may help you in the exam nowadays? That we say that a lot of clinical questions, things like emergency medicine are coming up. Is it possible that you can do something in the internship itself that can help you solve
these
it?
days they are giving a lot of case scenarios. So if you're well versed with the clinical aspect of a disease, how to approach a disease, so you'll easily mark those questions.
Will give you help that you've seen something in the internship. So it's not necessarily that if you are at the internship, I think it's better be more you take advantage of that internship rather than feeling that I am wasting my time. So what do you think, Anivita, about that?
I think whatever time that you're utilizing, you must remember that you are a doctor first and then a PG aspirant. So if you're there in a clinical scenario, if you're there in a setting, look around, see how the doctors are managing, how the consultants are managing, attend the rounds, get a feel of how a patient is approached. Because no book can teach you how to approach a patient, no book can make you memorize exactly how a patient presents. So that clinical scenario, those instruments that you see day in and day out, they're a part of your memory which no book can actually compensate. So I think if you're right there, try to make the most of it rather than escaping it and worrying about that your time is getting wasted.
Till now we summarize. Plan, stick to your plan, see that you have 3 revisions. Even the toppers cannot complete every subject. Swasti got rank 6 during her internship in NEET. She says, I used to complete 80%. Right? That is a key. Because she never tried to complete 100%, she could do 3 revisions. If Swasti would have tried to complete 100%, I believe we would have never got that 15 days at the end, where the third and the most important revision which all 3 have highlighted. The key is understand that entrance exam preparation can never complete 100%, not even toppers. Right? And then when you go ahead with the images, keep the images ready. And Dipin made a beautiful point. Have an idea what can come as an image in every subject according to the question being asked. We go to the second level now. You are 10 days prior to the exam. I get this mail as number 1 hit. 10 days, last 10 days before the exam. What do you read? You will listen to a voice which will tell you what he did.
So last 10 days, first thing is you need to make a list of all things you need to cover. On first day, make a list. Sit down for 1 hour. Make a list of all things. Like individually, first note down all the 19 subjects and try to make what all important you want to cover. Now, what is most important is that it is very difficult to do image-based questions at the end if you have already not compiled it somewhere. If you have already compiled throughout your internship the image-based question, the relevant images somewhere, then it is very good. Then you can give a glance to all the images on the last day. But for individual subjects, it is very important that you should now focus on things which involve more of recall, more of cramming, because it is not the time to build your concepts. Your concept building time is over. Now you have to focus on things which you tend to forget. And it is very important to focus on topics which are repeatedly asked, because the topics which are repeatedly asked, they tend to recur in the exam, and it is very important that you should not do those questions wrong, because to do those questions wrong, then you will fall out from the fight of getting a rank. First of all, you have to clear the race for getting a rank. Then you focus on performing well and getting a top rank. Apart from that, don't get confused. Don't change your plan every day. In last 10 days, you will start with a subject. In the middle of the day, you will feel this is not working out. Stick to the plan you have made. It is very important to stick to the plan you have made, even if you feel your pace is going down. And in case you waste any day and you realize कि आज का दिन तो waste हो गया, अब कल करेंगे, the tomorrow is not gonna come. Even if you are, let us say you have wasted 2 hours, 3 hours in a day, in crucial time, don't give up the remaining hours of the day. It is very important because every hour at that moment counts. So you have to forget what has been wasted and focus the time ahead of you.
So you have 2 plans. Plan A, Plan B. Plan A, what you want to do. Plan B is equal to Plan A. There is no other plan. That's the only way. So now we want to have a word. What to do in last 10 days. Are we doing MCQs in last 10 days? Or what are we doing in last 10 days, each one of you? We will start with Swasti.
In the last 10 days, you should. I didn't solve any MCQs. I just subject wise I revised the things which I tend to forget during my first and second readings. So I revised those, highlight
Volatile topics.
those.
So you had a list of volatile topics.
Yeah.
We just heard you should do the most frequently asked topics. One more view, most volatile topics. Minimal MCQs, but preferably one mock test to time yourself. Anivita, last 10 days.
So basically I divided my 10 days into 2 halves.
Right.
First half used to be the selected MCQs which I had circled throughout my previous preparation, and the second half used to be a high yielding short subject, because as we know, out of the 200 questions in AIMS and out of 300 questions in NEET, almost 20 to 30% is short subjects, and 1 hour of reading a short subject is very much more productive as compared to going through a whole huge bulky topic. So I divided those 10 days into the short subjects which I wanted to revise, and a few major subjects which I had revised long time back, which were not fresh. For example, biochemistry and anatomy. So, and also at the end of the day, before sleeping, I used to go through my list of pictures which I had collected. So the named, say the named syndromes of medicine which come very often, some anatomy diagrams, some cross sections, a few cycles or pharmacology tables, and microbiology images, things like that. So with that, by the end of those 10 days, I could figure out that at least I have covered most of the high yield topics, and the major subjects were in the back of my memory.
Depends, sir.
This is to gain the maximum amount of knowledge, and maximum knowledge you have to cramp it up at last 10 days. So I will never go for a mock test in the last 10 days. I will better go for last 3 papers or maximum 4 papers, and that too I won't read everything. The moment I start reading the question, I feel like I know that question, I just skip it. Whichever I don't know of the previous year question, I just read that very fast. And most of the time I will be opting late night time, whenever you are like study the subject, a particular subject, and you are really exhausted just 1 hour before going to sleep. I will opt that time for doing the questions. So at that time I will be doing the previous year 3 papers. Then coming to the images also, I won't be opening every folder, every images. If I have a list, I will be going through that list, and preferably I will be going through anatomy images, then physiology graphs, then I will be going to derma sport diagnosis. In ortho I will be going through x-rays mainly. So very specific in images also, not all images. Then coming to the topics which I am going to read, mostly I usually make a lot of notes. So I have notes of volatile topics, so I will definitely go through that. The next point is like there is a lot of subjects which are easy to study but you lose it very fast, like biochemistry, micro, forensic. These are subjects like it's easy to read up but you forget very fast. So I will be reading these subjects at the end. Then there are some subjects like which score very high, like path, medicine and all. So important topics in those lists I will be reading. So it is better, like what I will be doing is like I make a list of 19 subjects in my whiteboard, and I will be thinking like whichever topic I have to read. So whenever I am doing a question, I feel like okay, this topic I am weak, I have to go back and read. So I write it down in my whiteboard and I will be striking it off one by one. So that is one approach which I will be following. So a combined approach in the last 10 days, but you should be very specific, up to the point. You should not waste even a single minute.
One thing which I would like to add is that in the last 10 days, dedicate at least, what I am of the opinion, dedicate 1 day at least to the forensic. It is one subject, you can revise an entire day and you will go and do straight 10 questions correct. It is all memory based. There is no subject, even biochemistry and all short subjects, you will not be able to cover thoroughly. But forensic is one subject, including the IPC section, which can be dedicated thoroughly and should be finished from first to the last.
What I used to do was I used to revise the volatile subjects in between. Like I used to have a small group of 2 or 3 people, and we used to discuss things up, like these things, IPC sections and various factual things. You can easily revise them up by having discussion with your peers.
So we will summarize this. Have 3 revisions. Last 10 days are extremely crucial. Either do the high yield topics or do the volatile topics depending upon the field that you have for the importance. See some marked questions if you can do. This is the time to cram up and revise maximum number of things.
Another question I would like to put to everybody is like how many previous year papers would you suggest if you have to go and look back? So how many years of previous year papers did you do? Because they are available from 2000. I think that amount of questions are not required. So what is your opinion regarding previous year papers?
Aniveta.
So I don't think a 10-year set is required. For different exams, a different approach is required. So for PGI entrances, what is usually seen is that they end up repeating the topics very frequently. So for PGI, in that few, for example, if you're devoting the last 1 week for PGI question papers, it's a very good idea to go through as many papers as you can and go through those topics. But for AIMS, as the pattern has recently changed, it has come from image-based question pattern. So I think last 2 to 3 years will suffice. And for All India now, the pattern has completely changed. So going through the old NEET pattern or going through will be much less productive as compared to going through the previous All India pattern. I think the AIMS pattern and the old All India pattern is what is going to be repeated this time. So those questions, a few 2 to 3 years questions will be good enough.
Last 3 or 4 year, previous 3 or 4 year question papers, they will give you an idea about what are the important topics which you have to cover. They are never going to repeat the same question. They will repeat the topics. So
3
that
to 4
suffices.
years, depend.
For AIMS, it's like nowadays the pattern and the topics are almost similar, but they are never going to be ditto questions. So I would say like 3 papers, at the max 4 papers is sufficient. And for PGA, they are asking from the same tables, like they are putting Harrison tables and they are asking question every year from the same table. So yeah, you do maximum number of question papers for PGA, it's really good. For NEET, it's like previously also it was like 10 papers a year. So doing previous year paper, it's not going to help you much. So for NEET, I will better go for topic wise study. For AIMS, I will do 3 papers. For PGI, I will be doing like 6-7 papers.